Do you ever get headaches that come from clenching your jaw or have temporomandibular joint pain? Hi, I am Dr. Catherine Price. I'm a physical therapist, and I'm going to go over trigger point release of the temporalis muscle. The temporalis muscle is a muscle on the side of the head over the temporal bone in the temporal fossa. It goes and attaches into the mandible, in the jaw, and it's responsible for helping to close the jaw. So if you clench your teeth or you grind, sometimes this muscle can be irritated, and releasing this muscle can help to alleviate some of the headaches that come from the temporalis muscle, as well as jaw pain. Also, if the head is displaced in a forward head posture, the muscle tendon relationship can be disrupted and develop trigger points and problems in the jaw, which then can create headaches. So first thing you want to do is find the muscle. So you can go right behind your eye, just above the ear. It's going to be a fan-shaped muscle that just goes right above that area. What I'll do is I'll take my fingertips, go right above the ear, and you're going to just gently press in, and then you can go up towards the top of the head and come back down towards the ear, and you're looking for tension. And then spreading your fingers, you can then go perpendicular to the muscle and further find any areas of tenderness or tension. When you find an area of tenderness, you want to hold for about 15 to 20 seconds, and then just try to allow the pressure to release that tension, and you should start to feel that tenderness just decrease as you're holding that. Sometimes it takes a while depending on how much tension is in that muscle. So I want to release the muscle, the temporalis muscle. I'm just going to gently go towards the top of my head, and then staying, and I can even come close towards the front area as well. So spending 2 minutes just working on the fascia, which is the connective tissue that wraps the muscle, as well as the muscle itself, where there are any trigger points. I can feel tenderness in those areas. So I'm just going to mobilize and release that tension. You may find that you have one side more tense than the other. And if you have problems with that temporomandibular joint on that side, you may find that there are areas of tension in that side more so than the uninvolved temporomandibular joint. After the release, then you want to restore that muscle tendon relationship by stretching. And to stretch it, you're just going to open your mouth and take your fingers, and I'm going to press into the muscle and gently go up towards the top of my head as I open my mouth. And if you take a breath in, and then as you exhale, further stretch that muscle towards the top of the head. So I'm going to open my mouth, take a breath in. As I exhale, I'm going to push towards the top of my head. And I can do that for 30 seconds to a minute to get a stretch in that temporalis muscle. So that is the trigger point release of the temporalis muscle that can be involved in pain, that can be in the upper portion of the teeth, the temporomandibular joint, and just on the side of the head can be responsible for headaches. So if you're having temporomandibular joint problems and headaches from clenching your jaw, this may be a helpful tool to use to help alleviate some of that pain. I hope this is of help, and have a blessed day.